So when we look at the issues that we were dealing with when the Children's Campaign was first established, and healthcare was probably at the top of the list, there was very little coverage.
Almost all the kids that I was seeing at that point in my career were uninsured. Medicaid was very limited in the state of Colorado, and you really had to be very, very poor to get Medicaid. And we're very young.
So the whole area of providing health insurance for children was a top issue that the Children's Campaign took a leadership role.
I got to work on some really amazing things when I was in-house at the Children's Campaign. I got to work on the establishment of CHP Plus, the the Child Health Plan.
We worked with the Joint Budget Committee to make the Youth Violence and Prevention Program, which to this day is funding youth prevention programs.
Some of the things I'm proudest of that we did at the legislature, at the Children's Campaign during my time there would be cutting the number of kids who had no health insurance in half, working with partners to ensure that all kids had a medical home.
The Vaccine for Children program, which made vaccines available federally to all kids who were uninsured or on Medicaid, was a really powerful tool to be able to create access to vaccine delivery.
Anytime that there are people at a table talking about the health of Coloradans, the Children's Campaign is there to say, don't forget about kids. What are we going to do to ensure that our kids have access to health?
We are the voice for Colorado's kids, and we are serving as their voice at the Capitol. We are their seat at the table when we're having conversations about policy, and we're also amplifying data and research that is so important to understanding how kids are doing in our state.
They've been tremendous advocates on different components of our budget, making sure that working families who rely on Medicaid or CHP Plus are able to access those healthcare services. I really appreciate that, their influence extends far beyond just the child, but really the child and the child's family.
It was being able to create these cornerstones of a safety net for kids that was so gratifying.
Without the campaign, we would have missed the mark in delivering policy that really makes a difference.